Hey guys, a little bit different environment than you're used to seeing me in tonight. I'm actually in my office because I'm not going to be moving around. I'm not hurt, but the question that I'm going to answer tonight does not need any up and down, so you're just going to get me talking at my desk. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are talking about which doctor should you see. So this is a question we get asked all the time, and it was actually asked on our YouTube channel, so we are addressing it now. And we're going to talk about the difference between chiros, PTs, personal trainers, PCPs, orthos. I wrote a whole list down of what I normally get asked about and who they should see. So let's kind of go through the list a little bit. So we're going to start with chiropractors. Chiropractors are experts in back and treating the back and neck. I know some of them say, oh, they'll treat the knee, they'll treat other parts. They really go to school to learn about the back. So it's important to understand that the knee, the ankle things, they are not the best at treating those. Some of them have more specialized training where they've gone on to treat soft tissue issues. But what we usually find is there's a chiropractor and there's a massage therapist that will work in tandem. So that's not advantageous when you are looking for continuity of care, one person to kind of manage your pain. So usually when we're talking about chiros, we're talking about neck and back issues, nothing really else. Again, it may extend to some specialized training after school, but really we're keeping this nice and broad. Chiros, neck and back. Let's talk about your primary care doctors. Primary care doctors are there for your colds, your pains that you can't explain, not really your muscle and joint aches, not really your back pain. I know so many people come in and they're frustrated because they went to their primary care and all they did was give them an x-ray and pills. And really that's what they do. They're not specialists. I'm not saying anything negative about them, but you shouldn't go so hard on them when they're designed to either refer you to the specialist or be able to address the issues they can in their office. They are not joint specialists. They are not specialists that, work in soft tissue. So just be aware that they are looking for major problems to rule out. They're going to give you the blood work. They're going to give you the x-rays. They're going to rule out the major issues, but they're not going to necessarily get into the nitty gritty and move things around. And they're going to give you medication. That's generally how they treat any sort of soft tissue or spine issue. So now let's talk about orthopedic surgeons. So this one always cracks me up because people come to me and we get a lot of people that come that say, well, all the orthopedic surgeon told me to do was he was going to cut me, and I don't understand that. You went to a surgeon. That's what he does. He's going to want to perform surgery. We can't hold that against them. That's what they went to school for. So orthopedic surgeons, you're going to get more if a surgery consult is appropriate. That's what they're looking to do. Their name is an orthopedic surgeon. So you go to them when you have the joint pain, the back pain, the neck pain, the knee pain, the ankle pain. But don't be surprised when they suggest surgery. That's their specialty. That's what they do. So they're not really going to prescribe you a ton of medication. They may give you an injection, but they're really going to do what they love to do, which is operate. So don't come out surprised or incensed when they suggest the route that is in their name. But this is really all-encompassing joint and any sort of knee pain, ankle pain, anything where your joints are hurting. That's kind of where you would start. Now you may be referred out to another specialist, but that's where I would start if you are able to with an orthopedic surgeon when you have that specific knee sort of pain. But again, don't be surprised when they want to operate. Next, we're going to talk about doctors of osteopathy, DOs. You're going to find these in primary care offices. Sometimes they have standalone practices. Sometimes they're part of orthopedic surgeons' offices. This is a doctor that has specialized in more of a hands-on approach. So they may actually touch you and feel around and look at your tissue and look at your muscles. That's not uncommon. So a lot of people will search these types of doctors out for primary care because many of them, their first response is not to write a prescription. And, it is more to do some manual treatments. That's how they were trained. They're doctors of osteopathies. Doesn't make them any necessarily different than just, an MD or your primary care, but they do specialize in more hands-on treatment. So some of them have gone the route of just being a primary care and writing more scripts and not doing a lot of the manual techniques they were taught, but they do have a little bit more experience in that manual therapy world. Now we have a podiatrist. So this is someone where when you have foot issues, you go and see them. They are not surgically inclined like an orthopedic surgeon. So if you're going to an orthopedic surgeon, they're most likely to suggest some type of surgery. Podiatrists, while they do perform surgery, generally will give you more of a conservative treatment, whether it be orthotics, whether it be injections, whether it be just some exercises. They are focused only on the foot, but they also provide more options than just more of a surgical option. So that's, what differentiates a podiatrist from necessarily an orthopedic surgeon that specializes in the foot. Now we're going to move on to personal trainers. So PTs often get compared to personal trainers. I went to school for a long time to get my doctorate in physical therapy, and as opposed to a personal trainer that you can get that overnight online. So personal trainers are there to help you get into shape. Be very, very careful about personal trainers. Again, it is an online certificate. I can go there in 2 hours and get one, and I can say I'm a personal trainer. You have to be careful because you don't want somebody that's going to hurt you. You need somebody that really understands how the body works and how you want to progress exercises, how you want to move, and you don't want that personal trainer that's going to stretch your hamstrings till they tear your hamstrings. So really be cognizant of this online fitness movement, of these online personal trainers. It is super important that you realize they are just there to further your fitness. They have no expertise in diagnosing injuries, understanding injuries. So again, I'm talking about a personal trainer. I'm not talking about an athletic trainer. I'm not talking about somebody who's gone to extensive schooling. I'm talking about simply a personal trainer. They are designed to make you stronger, but they are not trained to treat or diagnose or work within the confines of an injury. So just be aware of that. And then we'll get to physical therapists, which is what I do. And I think some of the most misconstrued professions out there. Most people think you come here when you have surgery or you have an injury. We are trained very, very intensely on how to treat all aspects of the musculoskeletal system. So joints, muscles, pain that you can't explain. That's what we do. That's what we specialize in. We specialize in hands-on treatment in order to do so. I know, again, just like personal trainers, there are not so good physical therapists out there that are designed to, that just kind of give you your sheet of exercises and you go see some assistant and, all you do is do these couple exercises and you go home. That's not what a physical therapist does. And if you've had that experience, I apologize for my profession. The good ones are going to get their hands on you. They're going to treat that area of pain. They're going to figure out where the pain's coming from. If it doesn't show up on X-ray and MRI, that's where our specialty lies. That's where a physical therapist really excels, is figuring out where that pain is coming from. So many patients present to us with pain that they can't figure out where it's coming from or why it hurts, or they've gone to their doctor, nobody knows what's going on. That's where we really excel. We get our hands on you, we figure out exactly where the pain is coming from, how to fix it, how to tell you to fix it in the future, and really provide a educational component so you don't wind up injuring yourself again, and also provide a hands-on component and some exercises so that you're able to continue your benefits at home. I know I gave you a broad overview, and I know everyone is going to want to comment that they know somebody that doesn't treat like that or this doesn't treat like that. I get it. There's a lot of different treatments out there. I gave you a broad overview on all of the different doctors that you can see. I don't want you wasting time going to your primary care when maybe that's not the best option for you. Getting your pain treated effectively and efficiently by the correct specialist is important and imperative right up from the get-go. So don't waste your time going to your primary care if you have shoulder pain or you have back pain, or don't go to urgent care if you have back pain. They're not going to be the people that are going to be able to solve their issues. You're going to get the pills. They give you Flexerol. I've seen it a million times. And again, I know there's a primary care out there that doesn't give Flexerol and they're very good, and I get it. But the majority of what we see, this is what we see. If you have those specific joint issues, start with your physical therapist. If you fell down and you had a traumatic injury, go to your orthopedic surgeon. I know insurance sometimes dictates where you can go and when, but if you have that type of insurance where you don't have to go to your doctor, your primary care, and you don't have to start there, don't waste your time. Find the appropriate specialist that is going to give you what you need. And never be surprised when you walk out of your orthopedic surgeon's office and they suggest surgery. There's surgeon in their name. If you or someone you know is suffering from pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office, 215-997-9898, and we'd be happy to get you in. Thanks and have a good night.